Hi, I'm Dr. Art Rosengarten. I'd like to talk a little bit about the treating depression in my therapy practice. Part of the problem that the severely depressed patient suffers is that they've lost all sense of meaning in their lives. They've lost a sense of why and why they do and what they do and where they're going and what their goals are and what the purpose of their life is. They lose all of that, and there's a tremendous despair that comes out of that often. So besides examining the negative thoughts that are always distorted about the self in the depressed mind, and we'll work on that through cognitive behavioral therapy, I also have tools and techniques I use to help the patient or client reconnect with a sense of their journey in life, going through the terrible depression of, say, the loss of a parent, and how everything is changing in their lives and that they need to find a new sense of meaning and purpose in life with this event. So one way that I help a person to connect with their sense of journey is through what's called sand play therapy, which is a Jungian technique of active imagination, where you can see behind me in these shelves, I have hundreds, if not thousands, of miniature objects, figures, people, animals, things, mythological characters, contemporary characters. And the way the sand play therapy works is I invite a client to make a scene in the sandbox, which I have right next to it, spontaneously, just to select some of these, just a small set of these objects, and to go into the sand and to make a scene in the box. That's the only instruction. The process is extraordinary in that it really is an invitation for a person to follow wherever their feelings are taken without rehearsing or performing some way that they would like to be, and allowing their real experience to guide them into the discovery process of a sandbox, which is a place that is a place of pure play, like child's play, where I encourage them to suspend their thoughts and their ideas about what kind of scene they want to make, and just let the objects actually pick them. And they can kind of put them in places that they don't really know why they're doing it, but something just feels right. So they may pick maybe 10 to 15 objects. They move the sand, and they're building a scene, and the scene is really a scene of their inner mental state or their inner landscape. And when they finish, I try not to analyze it too much, because it's more the experience of creating now with symbols their inner mind state out in an outer expression, is a connection with who they are and what their condition is teaching them or guiding them, where it's guiding them. That is very therapeutic. All of a sudden, the same mental state that is producing just so much distress and melancholy, etc., is now becoming the creative teacher and guide of a person's sand play experience. It has a healing effect on a very deep level to do sand play therapy with severely depressed patients.